Garcia here, one of the shoulder and knee surgeons at Orthopedic Specialists of Seattle. Today we're going to show an interesting video testimonial. This is a patient, outside surgeon, failed a rotator cuff tear, then failed a cleanup, and was sent to me with a really difficult situation. Basically, pseudoparalytic, could not raise her arm. She's still under 60 years old, so really not a great candidate for a reverse shoulder replacement. And we've got some new techniques. There's some slightly older ones over the last few years and a newer one called the lower trapezius transfer. So what we do here is we transfer one of the lower trap muscles. You've heard about the traps that do this. We transfer that muscle to the old infraspinatus tendon, and it's really good for actually two things. One, people that have weakness externally rotating, and two, people that can't elevate their arm. It kind of acts as a tuberoplasty in addition to adding strength. And so this technique is relatively new over the last few years, and we brought it here to Seattle over the last year and a half and had some really nice results. So you can see from her, we got her motion back. But what was really nice about this, you're able to get this type of strength back, and you can see that she's actually almost identical on both sides, which is even above average for what I see for these, and pain reduction, so hopefully you enjoy. Thanks.
Pain was constant, and it hurt even without any movement. It hurt lying in bed. It was really hard to just get comfortable. My range of motion was really limited. I could not raise my arm above my head. Out to the side and behind my back was definitely out of the question. I had just really gotten to where I used my left arm all the time for everything. So I had had two former rotator cuff surgeries before Dr. Garcia did my third one. The first one was a repair, and it failed pretty early on. The second one was kind of a cleanup of the second surgery, and that made it feel a little better for a while, but then shortly after that, it was just the worst it had been. I really had no range of motion. I couldn't raise my arm above my head. I was weak. And it was just a mess. So the doctor that had done those surgeries referred me to Dr. Garcia, and I thought I was looking at a shoulder replacement. I had just resigned myself to that, and Dr. Garcia luckily talked me out of that and told me he thought I was a really good candidate for a procedure that he had been working on, and so I put my faith and trust in him, and he did that surgery. But then after the first couple of days, it got increasingly better pretty quickly. I was given a medication for muscle twitches, which I think was my saving grace because those muscle twitches were horrible. And then I would say maybe a couple of weeks out, it was a lot better. I really didn't know what to expect because I had had those two former rotator cuff surgeries that failed, and so I really didn't know what to expect. I had kind of lost hope of really ever having full use of the shoulder again, and I mean, I can go up over my head. Do you want to see?
Sure.
Yay! And I can go out to the side. I can behind my back is still kind of dicey, but I am working on it, and it is getting better. My strength is getting better. It way exceeded my expectations. I really had zero, so that wasn't hard. But I'm so hopeful that I can get back to doing all the things I usually do. I'm a really active person, and I'm just really looking forward to getting back to all that stuff. And for the first time in a few years, feel like it's going to happen.
If you had to go through it again, knowing that you had this diagnosis, would you recommend it to a friend?
Absolutely, yes.